Rheumatology is often regarded as a specialty of brainstorming because it demands a high level of critical thinking, clinical reasoning, and problem solving. Many rheumatic diseases are complex, multifactorial, and involve multiple systems in the body, requiring the rheumatologist to integrate various pieces of clinical information and collaborate across disciplines. Here's why rheumatology is considered a field that stimulates intellectual brainstorming. HAR1, complex and overlapping symptoms. Rheumatic diseases often present with vague, overlapping, or nonspecific symptoms such as joint pain, fatigue, rashes, and fevers. Symptoms can be seen in numerous conditions, making diagnosis a challenge. Rheumatologists must brainstorm possible diagnoses, often considering a broad differential, including autoimmune diseases, metabolic disorders, infections, and even malignancy. For example, a patient presenting with joint pain, fatigue, and a rash could have lupus, psoriatic arthritis, or even fibromyalgia, and it takes critical thinking to sift through the possibilities. 2. Systemic nature of rheumatic diseases. Many rheumatic conditions involve multiple organ systems, such as the joints, skin, lungs, kidneys, heart, and eyes. Rheumatologists often have to consider how a patient's symptoms might relate to each other across different systems, leading to creative and interdisciplinary diagnostic brainstorming. For instance, a patient with pulmonary symptoms, joint pain, and skin involvement might be suffering from a condition like systemic sclerosis or sarcoidosis, requiring careful consideration of all systems involved to arrive at the correct diagnosis. Diagnostic challenges. Rheumatic diseases often lack definitive diagnostic tests. Many autoimmune and inflammatory diseases are diagnosed based on clinical judgment, the exclusion of other conditions, and the use of multiple tests that may be inconclusive on their own. This uncertainty requires rheumatologists to think flexibly and creatively to piece together a diagnosis. For example, in seronegative rheumatoid arthritis, patients may not test positive for rheumatoid factor or anti-CCP antibodies, yet they exhibit classical symptoms of the disease. This requires a brainstorming approach to reconcile the clinical picture with the lab results. 4. Longitudinal care and treatment tailoring. Rheumatologists frequently manage chronic diseases that evolve over time, such as rheumatoid arthritis, lupus, and ankylosing spondylitis. These conditions may require continual reevaluation and adjustments in treatment strategies. Rheumatologists must consider the long-term implications of treatments, side effects, and patient-specific factors when choosing a treatment plan, requiring innovative and personal approaches. A patient with lupus nephritis, for example, might need adjustments in immunosuppressive therapy based on renal function, flare management, and long-term health goals, demanding a tailored and dynamic approach. 5. Multidisciplinary collaboration. Rheumatology is inherently multidisciplinary, often requiring collaboration with specialists such as nephrologists, pulmonologists, dermatologists, and neurologists. The need to integrate diverse perspectives and expertise fosters a culture of collaborative brainstorming to ensure the best outcomes for complex cases. For instance, managing systemic lupus erythematosus with renal involvement may involve coordination between a rheumatologist and nephrologist to balance immunosuppressive therapies with kidney protection strategies. 6. Cutting-edge research and evolving therapies. Rheumatology is a rapidly evolving field, with new biological therapies, targeted treatments, and research constantly reshaping the way diseases are treated. Rheumatologists need to stay up to date with the latest advancements and apply novel therapies in a way that is safe and effective for individual patients. Diseases like psoriatic arthritis or ankylosing spondylitis now have various biologic options targeting specific cytokines, e.g., TNF inhibitors, IL-17 inhibitors. Choosing the right one requires thoughtful consideration of the patient's disease severity, comorbidities, and risk factors. HAR7. Rare and uncommon disorders. Many rheumatic conditions, such as vasculitis or scleroderma, are relatively rare, and some patients may have multiple overlapping disorders or atypical presentations. The rarity of these conditions means that rheumatologists often face diagnostic puzzles that require innovative thinking and extensive knowledge to solve. Conclusion: rheumatology is a specialty where clinical judgment, critical thinking, and creative problem solving come into play daily. The complexity and uncertainty of many rheumatic conditions, the need for personalized and multidisciplinary care, and the rapid evolution of treatments mean that rheumatologists are continually engaged in intellectual brainstorming to optimize patient outcomes. This dynamic aspect of the specialty makes it intellectually stimulating and rewarding for those who practice it.